Our team provides technical assistance, and what happens is that the women during their pregnancy, they come in the antenatal clinics for care, and so they're asked if they agree to be tested, and they are given, of course, first information about HIV, and they're encouraged to get tested. So these women, of course, there are some who are HIV positive, and then when they're HIV positive, they're given antiretrovirals, so that it's the simplest method that we use in Kinshasa, and that is just because the conditions are really pretty harsh, meaning that the antenatal care that is given to the women is rudimentary, the infrastructure is very simple, and so we use the simplest approach, which is basically giving one antiretroviral called nevirapine at the onset of labor, and then when the child is born, the newborn is there, within the first 72 hours, they also get the same drug. So people don't have the diagnostics like they should be available. There are really problems at all levels. So you have to strengthen care and treatment. And like you can have a patient who has free access and is followed and is doing well, but then needs surgery. Well, that's not covered in our program. So then what do? We don't really have resources for that, but we've had one patient who died because the family could not afford the surgery.
This is Mildred Bwyer Alma. Her husband died of AIDS, and she was wife inherited to her brother-in-law. Wife inheritance means that if your husband dies, you have to marry your husband's brother or a close relative. Mildred either had a choice to leave with her 3 kids and starve, or marry her brother-in-law. Soon after she was married to her brother-in-law, he died of AIDS too, and Mildred was pregnant with his child. She was sure that the child had AIDS, and she was sure that she will die of AIDS too. She was wife inherited again, but she gave a warning to this time to the next man, saying that she probably had AIDS, and if he married her, he would die. But he married her anyway.
Told me that he built hospitals in Zimbabwe or something.
Right, we help a hospital in Zimbabwe, that's correct.
What exactly do you do?
Well, I met the hospital director. Her name is Dr. Elizabeth Terrero.
Right.
Terira, a number of years ago.
Okay.
And Zimbabwe is a country that is, well, it's very poor, but in addition to that, it has a government that's made some bad economic decisions. So the country is suffering quite a bit. And in spite of that, Dr. Terrero, with the help of 2 other women doctors, and now actually there's 1 male doctor there, have worked very hard to provide health care to the underserved people. 115,000 people live in the area served by the hospital. Now these women, these doctors, kind of left Zimbabwe because living there has a lot of hardships. But instead, they've remained there, and they work hard, and they use their imagination, and they find ways to help the people. Sure.
I had a question. You said that Zimbabwe's government has made certain poor economic decisions that have affected AIDS and the hospital in particular. Can you elaborate on that? I mean, what are the decisions the government's made that you thought were especially problematic?
Well, they have a situation in which, let's see, I guess I'm trying to figure out the best way to explain. Well, for one thing, they have decided, the government and the ruling party Zimbabwe African National Union Patriotic Front, it's called ZANU-PF.
Right.
They're the ones who are controlling the purse strings for the nation. And one of the things that they decided to do was take over the farms, the large commercial farms that are owned primarily by whites who have lived there for a number of generations.